Be empowered. Be strong. Take charge. Speak life. Live life abundantly. Get with it now. You are now entering the chat room. Health Chat with Coach Jean, that is, where we debate, debunk, educate, empower, impart, and raise awareness on all things related to health, healing, and holistic well-being, body, mind, and spirit. Let's go.
Hey everybody, what's going on? What's going on? Good evening, good evening. Welcome, welcome, welcome one, welcome all to another episode. Listen, from wherever you are tuning in, I want to personally welcome you to another episode of Health Chat with Coach Jean. This is your girl, Coach Jean Turner from the ATL here in the United States. This is the show where we debate, debunk, educate, empower, inspire, and bring awareness to all things related to health, healing, and holistic well-being, body, mind, soul, and spirit. So let's get it popping. Yes, indeed. I hope you all are having a great week and having a great week on purpose, okay? And I just want to say thank you so much for tuning in, for joining me here in the chat room. And so, look, as always, if you are tuning in, if you are live streaming and would like to comment or have a question regarding tonight's show, go ahead and inbox me at Health Chat with Coach Jean at gmail.com. You can also comment on my Facebook, IG, Twitter pages, and my Health Chat with Coach Jean page, or go to LinkedIn at Nurse Coach Jean. And look, under the promo, go ahead and type your comments or questions for this week's episode, okay? And so, look, tonight we have a special show. Bear with us, okay? Great, good, yes. Everything works out for the good to those who love God and are called according to His purpose. Yes, I love it, love it, love it, love it, love it, love it. God is on time. Let me tell you, He is on time. I am just ecstatic, what God is doing, what He's done, and all that He's going to do, and I hope you are too. But, tonight's show, I hope will leave you thinking about what I'm about to ask you. I want to start out tonight by posing the following question. What does changing the narrative mean to you? Tonight's show is meant to be thought-provoking, and so I hope you take away what it is meant for you to take away from tonight's show. As my guest and we're going to be talking about the health care narrative. And so what does that mean to you? What does health care look like to you? What should it look like to you? Based on your current situation now, based on the situation prior to if you are currently experiencing COVID or some other illness or a disease process. But I want you to think about, what does changing the healthcare perspective look like for you? What does that mean? And so, do you view healthcare in your community, in your situation? Do you view healthcare as poor or good? Do you view it as harmful? Do you view it as great? Do you view healthcare as a system that's proactive or reactive? Do you see it as a healthcare system or a system for health? And so, in a perfect world, what would healthcare look like to you? And so, as I prepare to bring on my guest for this week's episode, I want you to ponder on those things. And so to give you an example, for me, Coach Jean, changing the healthcare narrative would be a complete 180 from what it is here in the United States. You know, it would go from a healthcare system to a system of health, a system where your health insurance doesn't make choices on your behalf based on your insurance plan, but would be one that allows you, the consumer, to choose whether or not you want conventional treatment or if you want to go the naturopathic route. And so, you know, because the bottom line is we pay for it. Ain't nothing free. So whether you have private insurance or whether you have Medicare, Medicaid, you paying for it. Somebody is paying for it. And if you are tuning in from a country outside of the United States where there's universal health care, you are still paying for it in some way, shape, form, or fashion. And so on tonight, my guest and I are going to have this discussion. So let's pray real quick and get with it. Most gracious Heavenly Father, we thank you for another week, another opportunity to be present here in the chat room, Health Chat with Coach Jean. I pray that those who are listening to the live stream, those who would catch the replay on one of several platforms, that, Lord God, that something said tonight would bless them, something said tonight they can take and ponder on and would make choices that are conducive to their current state of health, the current state of health of them and their families. We pray right now for health, healing, and wholeness, body, mind, soul, and spirit. In your precious Son's name, amen, amen, and amen. And so, on tonight, for this week's episode, my guest is a 27-year healthcare professional who has experience with hands-on therapy care, care coordination, and physician management and recruitment in various hospitals and healthcare systems. Being a director of care and health and a wellness advocate, nothing brings her more joy and happiness than to be able to take the weight of worry off of someone's shoulder as they are navigating through their health and wellness journey. My guest tonight uses her experience and knowledge to help people be their best patient advocate and directs them to quality information, services, resources, and support. Being of service to others and successfully navigating them through the healthcare system is priceless to her. And at the end of the day, it is always about how she can help you and others like you to become a better, healthier, happier, less overwhelmed, and stress-free you. So on tonight, I want to introduce and bring here in the chat room no other than Miss Piper Grigsby. Miss Piper, are you in the virtual building this evening?
Hi, I'm here now, Jean. How are you doing?
I'm good. How are you? How are you? I'm glad you were able to join us.
Yes, thank you. Busy day in the life of care coordination, but doing good.
Well, wonderful. Well, that's always a good thing, right? Health and strength and doing well is always a good thing. And being busy in your business of taking care of others is a good thing as well. So thank you for joining us here in the chat room on this evening. I sure do appreciate you. And so I want us to start off, if you don't mind, let's begin by you sharing with our listeners what exactly you do, what it is that you do, your company, and tell us a little bit more about yourself other than what I spoke of about you.
Sure. So I own two care-based companies, one for seniors and their families. And what that entails is if you or your family member are in the hospital for whatever the situation is, and then you need to go home with coordination of care, that's something that myself and my team, we provide. So I coordinate all the aspects of sometimes a primary care, provider coming in to rehab, to decluttering, cleaning, moving, you name it, we have it. So we try to provide services that will alleviate the situation that families are in need of help in. Or if they are going to assisted living, we provide that as well, and making sure that there's a continuity and quality of care. And then our second service-based business, which is a women's concierge service. Again, care coordination, realizing that, it's about access, it's about needs, it's about personalization when it comes to health and wellness. So once again, being the conduit of care and services provided to different ones, not just women, but also their families. So to be their children or their husbands. So it's just being a service for the whole family.
So basically, if I understand, you and your company help to coordinate care throughout the whole healthcare process, like from one provider to another, one entity or another, based on the patient's or the client's care needs. Y'all basically help to coordinate that between these different entities. Is that fair to say?
Correct. And as well as the other key pieces, education, we understand that it takes a village, and it also takes, as you were saying about changing the healthcare narrative, well, the only way that that can be successful is not just by providers being there and ready to help and care for people, but it's also for people to know how to navigate successfully themselves, to know what questions to ask, to know what type of care and health providers that they need in their realm or village of health and wellness. So it's different aspects, yes, care coordination, but of course education, because people can make the right decisions if they have the right knowledge. So it's providing them everything they can have: support, resources, services, and education.
I can dig that right on, because as patients, as consumers of healthcare, we all need to have enough information and be informed so that we can make informed decisions. So it sounds like also, you help to teach them how to be their own patient advocate.
Correct. Yes, because, it's just like anything they say, you can give water to horse, or bring a horse to water. But where you can
right.
Say you can give. I know. I get it. I'm not great, everybody, with these sayings. So you can bring somebody fish, but if you teach, and that can last a day. But if you teach them how to fish, that can last them forever. So the same thing in the healthcare and wellness system. You can do things for people. You can make the appointments. But like many physicians, which I actually communicate almost daily with, there are a lot of physicians and providers out there who want to help, but it won't help if people are not consistent with what they're being told to do. And the only way that people or we as a community are going to do that if we understand what's happening with us. Why, doctors or providers are saying, do this, don't do that. So the best way that we can be successful is by being a part of that process and being our own successful patient advocate.
Right. And you know what? I'm glad you said that, because that's what I tell, providers, because it's one thing, you go to the doctor, right? And the doctor says you need to do A, B, and C. But because they have so many patients, shorter staff, or whatever, insurance dictates how much time you spend with each patient, whatever the reasoning is, right? They tell them do A, B, and C, but they don't tell them why they need to do it most of the time. The majority, not all, but the majority of the time, patients are not told why they need to do it, and they're sure not told how they need to do it. And that's where people like you and your services come in. That's where me as a nurse coach comes in, that to get to the why you need to do it, this is how you do it, aspects of it, because you're not getting that. You go to the doctor, you wait an hour or so, but really you spend 5 minutes in the exam room with the doctor, and then they're off to the next patient, and you still just as lost as you was when you first walked in there. And so, yeah, that's part of changing the healthcare narrative. And so I love that. I love that saying, changing the healthcare narrative. And I had not heard that term used before until you and I met, right, on Clubhouse of all places, right? But you and I have had some discussions, and I know that you had an experience. I'm not sure yet whether your personal experience that you shared led up to, you're changing the healthcare narrative, right? Or it was something you've been doing prior. So I'm just going to ask, based on our discussion, you don't have to share if you don't want to, but what was it that made you focus and pivot to this changing the healthcare narrative? And in your words, what does that mean?
So I'll answer the first part. What made me do this is because I did experience, first of all, some disparities or disconnection when I decided to move across country. And I went from having the same doctors from OBGYN to primary, yada, yada, for 12 years to who do I go to? And so the norm, which the healthcare narrative, I'll explain that, but it consists of so many different levels. So the one level of us searching out for providers has been for so long asking our friend or our next door neighbor who you go to, who have you heard is a good provider. And so that's all good and well, because obviously if we have friends and people that we trust and we trust what they, their opinions are, of course we're going to say, okay, that might be well. But we have to understand that we as the people, we are all very different. We've been made up different. We're in different environments. We're affected by different DNAs. Our hormones are different. Our emotions are different. And so with that being said, our healthcare formula has to be different from person to person. So what works for me is not going to work, may not work for my next door neighbor, even though it's working out for me and I'm having a great experience. That same person may have different experiences and different outcomes. And so what I learned when I came to a different type or part of the, world, I said, hey, okay, who's a good doctor? Oh, I love her. She's been wonderful. But I ended up crying on the table because I felt the doctor was not connecting with me. She wasn't listening to me. And so instead of focusing on the matter at hand, which was very serious, and even looking into surgery, I'm worried about this doctor doesn't care about me. So I felt that has to change. Of course, I can't change the world, but what I can do is use everything I've experienced, my knowledge, and as my ability and gifts to understand the different areas of the community, being a care coordinator for so long, that I said there's something I can do about it. And the same thing, another thing is that identifying today, healthcare has changed and progressed. What does that mean? It means that we went from the yesteryear of when we used to get our blood drawn, we used to get electrodes on us, and it told the whole story. But now we're understanding as a healthcare community that that's very different, meaning that our emotions, our stress factors are all affecting everything internally. And sometimes those markers cannot be found on just the regular tools or medical equipment that we're given. So what does that mean is that now we have inserted physicians who are naturopathic, who are holistic. And so they don't just look at the radar or the reports from a machine. They also have markers of what's going on in your life, what are the stressors affecting it, okay, how is your body changing or affected when you have these certain things or equations in your life. So it just has to change of how we look at it. And it's going to take a village. It's going to take a village of us as a personal community and as a healthcare community. Everybody needs to be involved. So then we go to what does changing the healthcare narrative mean? What that means is that, first of all, how we look at it. What is the healthcare narrative? As you had explained, we all grew up in a healthcare system where insurance ran everything. What's your insurance? Okay, you can go to that doctor. We go to that doctor, then insurance runs how long that doctor can see us. So I'm a kind of person where, yes, I am a patient advocate, but I'm also understanding of providers and what type of things they're held by. And the old healthcare system, it held them by insurance, money, and time. Now, doctors are starting to see that they have to expand their viewpoint, their knowledge, in order for our community to truly prosper and succeed in a healthcare way. That they're seeing that, okay, we have to look at the stress factors. We have to look at why are they obese? Why are they having hypertension? No, it's not just about the race you are. It's about the habits that you've learned. Why have you learned those habits? Okay, it's the experiences that you're dealing with. You have high pressure, high stress jobs. You don't have anybody to watch the kids, and on and on. So that's why I said the healthcare narrative is a multi-level compound system that we have to look at it in so many factors and ways. But where it starts in changing that narrative is how we as a community and the people are looking at our own healthcare and wellness, how we value it, and then also seeing that we have a choice. It's no longer the time where somebody has to tell you you have to go to this doctor. If you are not comfortable, if you don't, that's the whole point. If there's no emotional connection, I'll go back to that, you're not going to be interested in what that doctor has to say, because you already are saying they don't have a investment in me. So why should I listen to them? Whereas you have providers that are personalized, that you feel understand you have a connection with, guess what? You're going to change how you feel, how you think, not just about the situation, but about yourself, and you're going to believe the people who are now given the, as they say, the gatekeepers to navigate your health. So it takes a village, and it's healthcare providers and it's us as a community. But there has to be that middle person who is able to mediate, to balance things out and bring it all together. And that's how I look at myself. And that's why I took on this mission of doing that, because being a care coordinator is not just knowing what everybody does. It's knowing how to communicate with everybody. It's knowing what to ask for from everybody for the benefit of that one patient.
And so, a lot, and I believe that's why, we connected, Piper, because a lot of what you said is what I, as a nurse coach, does. And a nurse coach is different than a health coach. And it's for the reasons, many of the reasons that you said, other than the fact I'm a nurse, right? We look at a holistic health nurse coach looks at the 9 dimensions of wellness, and we know wellness is more than just the physical being, right? Wellness encompasses the mental well-being, that's social, emotional, spiritual, professional well-being, financial well-being, the environment, how you manage your stress. It includes so much more than trying to treat physical symptoms. And so, now, and I'm going to tell you, I've been a nurse since 87. You've been in healthcare for over 27 years. We have seen it change since probably the mid-'80s, right? We've seen healthcare change. We've seen it become more monetary driven. I've seen it to where, many CEOs and healthcare organizations and corporations, they're not doctors, they're healthcare providers. They are business majors, okay? They've been taught finance, they're finance majors. They're not healthcare professionals. So it is important that we, and this is coming from, my profession where I've worked, primary care, hospitals, a variety of settings, especially hospitals, especially being in the military for the 25 years of my 34-year career. This is why it's important that we have people like you, nurses, doctors, medical professionals, care coordinators, also in the boardrooms of these healthcare organizations, in the boardrooms of these insurance companies. I would love to see that. I would love to see more nurses and people like you in these boardrooms making the decisions, as such, because we see the bigger picture. We're not driven by cost. Yes, cost is important. It takes money to run organizations. Got it, tracking. But at the same time, you have to begin to see things from a patient-client perspective. And I'll admit, yes, being a nurse for all these years, I gave the best care I could possibly give. I gave high-quality care. But to be honest, as being a person who's never been sick a day in their life until 2018 when I had my suddenly health challenge and was in the very healthcare system that I served in all those years, I feel like I need to go back and apologize to every patient I ever took care of because I truly did not understand how they felt being on the receiving end of our healthcare system. And you've heard me say that before.
Yeah, and Jean, and the thing is, at the end of the day, because a lot of things happen, I talk with a lot of people with a lot of different situations, postpartum situations, different issues and challenges. And I understand we may want to go back and apologize, but we have to understand, just like everything else, everything is progressive. We look and let's give an example of that. I love examples. We look at our food system, and we went from McDonald's to having, we have meal preps now. We have these different things that we have now because life changed. The women went from just being in the home, taking care of the children, to now working, to now saying, okay, what can I whip up fast or get fast to feed my family? So with that being said, that's when fast food started to become a thing and more into households, and then that we started seeing decline. So now we're getting back to it to where now we have these fresh food, meal preps sent to the home and all these different things. So we only can do what we know, right? We can only do what we're taught. And at the time, the systems just weren't taught that way. The systems were, I'm the doctor, you're the patient, you listen to me, and that's all that matters. Now, as we have evolved as people, as the earth, as the world, things and the systems have evolved. So with that being said, now we really see, okay, this is what needs to change. And so we can't go back and change what was then, but now that we know, now that we're being educated, now that people are speaking up, now that people understand that they have a voice and that they need to share that with their doctors or people or whoever it may be. I've done that. In surgery, coming out of surgery, I went for my checkups and my doctor said, oh, this is the 6-week mark. You should be here. You should be fine. No, I feel my body tearing inside. I feel X, Y, Z. Well, you shouldn't be. Okay, but I'm not that other patient. I'm me, and I'm going to stay on bed rest. So it's learning to be vocal and that it's okay to be vocal because and learning from different holistic providers how your body works, how it's feeling, how to listen to your body so that you're not waiting to go to an emergency room and for an x-ray to tell you. No, I've done that too. I was sad. I couldn't drive. Doing care coordination, I went from hospital to hospital. And I found myself, I couldn't drive. I couldn't hold on to the steering wheel. Well, as a woman, you have to be understanding that you have to listen to everything because unlike men, everything could be a stroke. I'm not saying to scare people, but you just have to listen to your body. Stop and listen. And so I was taken to the emergency room, and for 6 hours, blood work, x-rays, ultrasound, CT scan, everything. And still they left, nothing's wrong with you. So unfortunately, because I'm a person who doesn't take no for an answer, I did feel very like I'm not crazy. I know what's going on. And it came to find out after all those tests, it was that I had a misplaced rib from my chiropractor, who's a holistic provider, you guys. So that's why it's so important to know what is out there, what support you have, what resources there are, because it's not like yesteryear. We now have all such various types of care and providers and resources that have changed. And when you have the knowledge of that, you have such a wealth and value of your health and wellness, and you'll know how to navigate it. And we as providers, we have to educate each other now. So just like you now are in this new spectrum of the new healthcare narrative, Jean, now it's time for you to take what you know and train other colleagues to understand and listen. And once they see that, they're like, oh, we have to change things. So it becomes a domino effect. But, you know, look, 27 years ago, a doctor didn't really, they wouldn't prescribe occupational therapy for stroke victims. And many people don't understand, but occupational therapy helps with neurological and with cognitive things that you don't get from physical therapy. But guess what? Now it's the standard. And I remember at 17, yes, you guys, 17, I was there communicating to physicians. We have to. This guy just had a stroke. He has a lot of chances to recuperate and gain back certain functions and mobilities and cognitive. And I had to go over it over and over again. Now it is a common thing. So guess what? What we're doing now, communicating, talking about it, teaching, educating, and also making sure that we are finding these resources and bringing it to our community, one day we'll look back and say, you know what, now it's a common thing. So it's just a regular progression of life, but it just takes people like you and me to try to help move it along and make things happen.
Yeah, and I like that. I really like that, and I appreciate you saying all of that because it is true. So, you know, the question becomes then, you know, those of us who are in healthcare, we talk about it, we educate, you know, we teach others. But for the listeners who are tuning in tonight and those who will catch the replay, what can we do as individuals, you know, even for, you know, someone who is a lay person, not in the healthcare profession, who's a patient, what can they do? Now, we know knowing your body is very important. You have got to know your body. You've got to know what's normal for you and what's abnormal for you, because what I've learned and what I tell other people, everything is not textbook. You know, I had the experience on the night of August 7th, 2019, that my symptoms were not textbook. I went to the ER. I told my husband, I got to go to the emergency room. Something ain't right. I went to the emergency room. My vital signs were normal when I got there, but I knew something wasn't right. But because my vital signs were normal, Piper, they had me waiting out in the waiting area for 6 or 7 hours to the next morning. And guess what happened as soon as they called me back to be seen? I coded right there in the emergency room. So we've got to know our bodies and know that something is wrong. And like you said, speak up. We've got to be our own patient advocates. Got that. What else can individuals do? You know, do their part to change the narrative.
So there's a multiple things. One is to understand that you need to have a care team in your life. What does that mean? Many times we look at, I have a primary care doctor and think that's enough. It's not enough. Do you have a nutritionist on hand? Do you have chiropractic care on hand? Do you have massage therapy on hand? Do you have acupuncture? Do you have naturopathic doctors? People don't realize, but there are so many levels to our health and wellness that we need to know that these people are out there and they work together, because what we're used to is piecemealing our health care. That's my favorite thing to say. We're used to saying, I have a headache today. Okay, let me go to the doctor and talk about the headache. I have a sore throat and a toothache today. Let me go and find out what's going on from the ENT doctor. Guess what, folks? Our systems are very intricate. That's why we always say we're wonderfully made. So if we're wonderfully made, we'll understand that one part of our system, one part of our life is affecting another. A lot of times those headaches are just not, let me give you some aspirin. No, you could be having, what are you eating? Your nutrition. Are you eating too much salt? What does your diet look like? Your job? You're not getting enough sleep. You're getting 2 hours of sleep a day. And all those things start to compound and start to create all these different issues that takes more than one provider to look at. So understanding that. Also, too, what I see is that we are not taking advantage of services and systems that are now popping up, such as what we do. If you see that, yes, it's different, what can you do for me? I hope this discussion period will show that a care coordinator in your life and a patient and an expert patient advocate, they can help you navigate, ask questions, even understand how and what you need quicker than you can. And then they can quickly identify, okay, you need to go to this, you need to go to that. You're like, I never thought of that. Guess what, people? You're experts at whatever you're doing. So if you are a truck driver, if you are a CEO, whatever you do, that's what your expertise in, right? Because why? You studied it and you lived it and you experienced it. People in healthcare, such as myself and Coach Jean, this is what we have lived for. 27 years is no quick run around the block. So if you can have somebody like that in your life, take advantage of it. What do we always say? You know, it's about taking advantage of opportunities. The problem is we have not put the value on our health and mental status as much as we should. And that's another thing. Mental health therapy also. That should be a staple in your care team. And that we're talking about that now, and now on TV and celebrities. Okay, then we listen. Why can't we listen now that it's okay? We are in stressful times. We are faced with multiple problems, not just one. So especially if you're a parent and you're working and you're dealing with corona and you're dealing with the changes of life, whatever they may be. You need all of these people. An army, as they say, an army doesn't run off of one person. No, you have the person in charge. You have the people in the middle. You have the people on the end, the people on the back. And guess what? That's whoever succeeds, that's how they succeed. You have to look at your health and wellness as building an army. And guess what? We are out here now, everybody. So it's like taking discussions like these and taking them to heart and doing something with them. It is out there for you. We don't have to be 40 and 50 years old and have heart attacks. We don't have to, be, as we say, mistreated by the healthcare system. We don't have to be. So knowing that you don't have to be, if you want something done, I always say, whatever people want, no matter how hard it is, they'll work hard for it. Why aren't we doing that with our lives? Why aren't we doing that with the life that was given to us? So now that you know these resources and people are out here, and I'm the kind of person, if I'm not the person to help you, I do know who can help you. But having somebody who knows and can bring all these different people to you, it really is priceless. And it's changing the game. So just being aware of that, as you hear these discussions and then as you hear the resources, you guys, a doctor who is very endear to me now, she said, you're going to pay one way or another. You may pay with your time. You may pay with your energy. You may pay with, your money. But at the end of the day, if you don't pay with those, some of us pay with our lives.
Yeah.
So it's up to you. As I present to many seniors every month, as my team presents to other people, I always leave them with the thing is that we can't live your life for you, and we can't make choices for you. So how are we going to do this? If your life really means something to you and the people that you love, do something about it now that you know that there is help and now that you know there is solutions and resources just for you and people who know what they're doing and who really care and can bring you to people who know what they're doing and care. To me, a license is not enough. That's great.
No.
You being able to recite a medical case, that doesn't mean anything to me. What means something to me is the fact that, one, your approach to people, how you're caring for them, and the fact that you are willing to go above and beyond to educate them to be the best people that they want to be. Those are the providers you want in your life. And if you can't find them, guys, we can find them for you. So
that's right. That's right. You said a mouthful there, because nowadays we have people less than 40 years young having heart attacks. We have children that are 10, 11, 12 years old who are obese, younger than that, obese. I knew several years ago, a 12-year-old on high blood pressure medicine. Now, what's wrong with that picture? High blood pressure used to only be a disease of someone over 50. I'm 57. I don't even have high blood pressure. And so, it's like I say here, week in and week out on Health Chat with Coach Jean. I tell them, my clients, anyone who will listen, any imbalance in one system within our bodies creates disharmony throughout our entire body. And, the other thing I say, health is an investment. Many of us, we invest money to get our hair did. We invest money in shopping at the mall, getting nails done, and all these different things. But then when it comes to investing in one's health, investing in the massage therapy, to investing in, finding ways to reduce your stress, investing in probably, a gym membership or something, then many people, not everybody, want to hoop and holler and, oh, man, that costs money. Well, so does that $1,000 weed cost money and all these other things. So health is an investment, and it is imperative that we begin to invest in ourselves and mainly invest in our health. And God gave us the gift of choice. And like I always say, it's time to choose wisely. Piper, we got to get ready to go. The time goes so fast, I tell you the truth. We got about 2 minutes. It does. We have about 2 minutes left. I cannot believe how fast the time goes. Please kindly share your contact information, website, and how the people can reach out.
Sure. So the best way you can reach me is Piper at pgrigsbyconsulting.com. That's my email. If you are an Instagram person, you can find me under Your Dedicated Care Concierge and DM me at any time. And our website is www.pgrigsbyconsulting.com. So, or you can look me up on any social by my first name. It should pop up. But yes, however, I can be of service. However, I could be of service to you directly, or to direct you to where you need to be, or what you need. I'm here. I'm just here to be of service to our community.
Wonderful, wonderful. And if you don't mind, repeat that website one more time for our listeners who are not in the U.S. Your website.
Okay, sure. It's www.pgrigsby, G-R, G as in girl, R as in Robert, I, G as in girl, S as in Sam, B as in boy, Y, consulting.com.
Wonderful, wonderful. Piper, thank you so much for taking time out your busy schedule and joining me in the chat room, girlfriend. I appreciate you so much.
You're welcome, and I appreciate you allowing me to be able to speak to our community and be of service in this manner. So I appreciate it as well.
Thank you so much, and I will be in touch. I'll see you soon in the chat room, in the clubhouse, I mean.
All right. Take care, everybody. All right.
Have a good night. Thanks.
You too. Bye-bye.
Bye. And so to you, my listening audience, thank you so much. I hope you enjoyed listening. That was a lot of knowledge that Ms. Piper Grigsby dropped on us this week here in the chat room. And before we go, I just want to leave you with this from the Passion Translation. Right there, Ms. Piper spoke a mouthful. And then the question becomes, God uses other people to speak to us, to speak his message to us. The question becomes, are you listening? Okay? And so from the translation goes like this. This is a wake-up call. It's time to change the channel for ourselves and others. Our life-giving words over phone calls and emails and social media can lift off despondency and break the spirit of death. Let's flood the atmosphere with life-giving words. Let's get the gospel out there. There are people that are dying and they need what we have, Jesus and the word of life. Share some of the manna you gather each day. You will be surprised at how God will use you as a change agent. For you and I are called to change the atmosphere from death to life. Ponder and think about the things that you have heard spoken by Ms. Piper, Grigsby, and myself here in the chat room on this evening. Ponder and think on these things in the days ahead. And so, again, a very special thanks to my special guest on this evening, this week in the chat room, Ms. Piper Grigsby. A very special thanks to my producer, Mr. Jerry Royce Live, the Batman of Charm City. And again, to all of you, my faithful listeners, both here in the United States and throughout the various parts of the world. God bless you. I love you. Peace and health. And good night.
Thank you for joining us for another episode here in the chat room. Health Chat with Coach Jean, that is. Until next time, if God says the same, I pray peace, health, love, and well-being for you and your family. God bless you.
You are listening to Jerry Royce Live.